From KELOLAND Media Group, a KELOLAND News special report, Coronavirus Town Hall. Now your moderators, Don Jorgensen and Bridget Bennett.
Good evening, and thank you for joining us for this KELOLAND News special report.
It doesn't matter if you own a ranch or work at a restaurant. People all across KELOLAND are feeling the effects of COVID-19.
The disease has killed dozens of South Dakotans. Businesses are struggling, and so are families. Tonight, all three members of South Dakota's congressional delegation are joining us to talk about what they're doing in Washington to bring help back home. They're also answering your questions, and you have a lot of them. We received hundreds of questions over the past few days.
And we are joined now by Senators John Thune and Mike Rounds and Congressman Dusty Johnson. And with the CDC's social distancing guidelines in mind, our guests are joining us from outside the studio.
And speaking of safety, let's get started on these questions. Now, there has been some criticism about politicians not wearing masks. Viewers want to know if you wear one and when. Can you give us some specific examples? Let's start with Senator Thune.
Okay. Well, thanks, Bridget. And thank you for hosting us this evening. And hello to all South Dakotans. We know there are a lot of people experiencing hardship as we go through this crisis, but we will get through it. But one of the things that we have to do to get through it is make sure we're all following the guidelines. And we do wear masks here in Washington, D.C. when we're in session in the Congress, with the exception of me talking to you right now. We have our masks on the Senate floor. We have them on our offices. And then we move back and forth between South Dakota and Washington, D.C. on the airplanes. It's now required when you fly on the plane. So airports, airplanes, and then sometimes as well in different places moving around the state. So there are lots of specific examples, I think, of where each of us is wearing those masks, and like many South Dakotans and many people across the country are today.
Thank you, Senator Thune. Senator Rounds, any other instances where you also wear a mask?
We actually carry them, and in South Dakota we have them as well. But in D.C., yeah, anytime that we're in the office with other people in the same office with us, we're wearing them. And then also back in South Dakota, if I'm in a particular store or whatever, or like with my wife, Jean, if she's wearing the mask also. And so we're trying to be very, very careful. But there's two parts to it. Number one, it's because if we're actually carrying it and not knowing it, we don't want to spread it to somebody else. But second of all, we're going to do our best to try to set that example that says it's okay if you want to wear a mask. So normally in Washington, D.C. or on an aircraft back and forth, we're wearing the mask.
Congressman Johnson, same question for you.
Yeah, absolutely. Just as the senators mentioned, there are times when we're required to. But I know we're all fatigued by having this economy shut down more than we want. One of the things that is going to help keep us safe as we loosen up these economic restrictions is making sure everybody's following good social distancing practices, wearing a mask when you need to wear a mask. If we all use our brains and if we're resilient for just a little bit longer, normal is going to come sooner than it otherwise would.
What about social distancing? How have your lives changed in the past couple of months? Let's start with Senator Rounds.
Well, first of all, you're right. It has changed, and in particular, in our different locations, both in South Dakota and also in Washington, we've significantly reduced the number of staff that we actually have in the office with us, and we've rotated them. Normally, I'll have three people in my Washington, D.C. office, where I'd normally have like 17, 18, or 19 in there. In the same way back in the peer office, normally I would have 4 or 5 people here. I normally have 1 or 2 at the most with me at any one time. But then we rotated them so that if somebody in one of the groups got sick and the rest of the people in that one we quarantined, we had another group who could step in. And so, yeah, that's been part of it. And then also just the fact that, as many people have known, Jean, went through cancer treatments last year. And so we've been trying to be very extra special careful and cautious about separating out so that we don't get into larger groups at all. And when you got grandkids, that's really tough. But for the most part, we've mostly separation.
That's totally understandable. Congressman Johnson, how about you? How's your life changed? Congressman Johnson, how has your life changed because of the pandemic?
Well, Senator Rounds mentioned, of course, I've also got 3 young sons. And so a big part of the difference for us is that every day when I'm working here in South Dakota, they're also working in this house, trying to get a good education. It's not easy. It's not the same experience as they would get in the classroom. But I would tell you the overwhelming majority of their teachers are really doing everything they can to try to make sure that these kids are getting a good education. Tammy First, my 8-year-old's teacher, if the kids do enough good things about staying on top of their homework, she will, in a socially distanced way, bike to their house and take the kids one at a time out on a bike ride. When you see that kind of extra mile effort, you just get a very clear sense that although social distancing can be awkward, it can be an irritant, we are really going to get through this.
Senator Thune, how's your life changing? Question for you, do you have to stay away from your grandkids?
Good question, Don. We did, particularly our youngest daughter, Larissa, a couple of weeks ago, had her third baby. And up until that time, obviously, we were keeping distance from her just to make sure that everything went well with that pregnancy. And even now, around the grandkids, because I'm out here quite a bit and exposed to different things, I just keep my distance. And so, yeah, it's hard. I mean, like every family in South Dakota, we're all dealing with that. In terms of the professional part of it here, in Washington, when we go to the floor to vote, for example, in the Senate, instead of it being a 15-minute vote, they're now 30-minute votes. Members are encouraged to enter through different entrances in the Senate, come in, cast their vote, and leave, and not congregate down in what we call the well of the Senate, which is typically where conversations take place. So a lot of that, and we're back in South Dakota, the connectivity using Zoom, using Skype, using Google Hangout, using Shindig, using FaceTime Live, or Facebook Live, I should say, all different ways of maintaining connectivity. We're all having to adapt to the new normal.
Well, congratulations on the new grandchild, too. Well, we received a lot of questions from people on both sides of the political spectrum. And at this point, people say they don't know who to trust when it comes to coronavirus.
They are hearing one thing from doctors, another thing from a local and federal leaders, and of course, there is a lot of information on the internet. Where do you get your information, and how do you make your decisions? Congressman Johnson.
Well, it's a lot easier for the three of us than it is for most citizens. I mean, we're getting regular briefings from some of the smartest people on the planet. And for me, I try not to just look at one dimension. I mean, Dr. Birx and Dr. Fauci are incredibly smart. They provide a lot of good data, but they're public health experts. And I try to take that advice, I try to add it with what we might get from Secretary Mnuchin or what we might get from the White House Economic Council, add it to what Vice President Pence is sharing with us, and what we're hearing from South Dakotans, people who really understand what's going on in our backyard. I had a long briefing today from Avera. They did a great job of talking to me about how much PPE do they have. What does we're trying to test every single nursing home resident and employee in this state in the next 2 weeks. That's a major undertaking. What do they think about that effort and that attempt? And so I would say there's no one simple, easy, magic answer. I think people have to look, they have to listen to a number of different sources, and I think they have to trust those people who use data to make good decisions. I would close by saying this: when you watch the governor's press conferences every day, she's talking about data constantly. That always provides me a lot more confidence than if somebody's just talking about their gut feeling.
Yeah, Senator Thune, how about you?
Right. Well, I think, Don, that the key really is to have metrics that are consistent over time. And data is key to this, and science and medical experts. As Dusty pointed out, I think many of us rely on Dr. Fauci, Dr. Birx, and others in the profession who are very experienced at this. There are a number of other voices that are involved that oftentimes will be on some of the various news shows providing commentary and advice. But I just think it's really critical in all this to listen to the professionals, to listen to the experts, and then to make your own conclusions. And ultimately, it's one thing, I guess, if you can look at data, can be interpreted differently by different people, and that's going to be a part of this. I mean, I think sometimes you have to draw your own conclusions, but the fact is that if you can take a piece of data and it's a consistent, if you're filing, for example, cases or hospitalizations or whatever that issue is, but make sure it's consistent over time so that you're coming to conclusions based upon a trend line and not just something that's very static and at a point in time.
Senator Rounds, does it get confusing at times, this information that's being flowed back and forth?
It does at times, and I suspect that that's one of the reasons why people will get a little bit frustrated. Because remember, there's a couple of things going on. First of all, you have the people that are specifically experts in their field. Dr. Fauci is a great example. He knows his stuff. But then you also got a gentleman by the name of Dr. Collins, who knows his stuff as well. and they have different areas of expertise. We use them both. But then you have the individuals such as Steve Mnuchin, and those individuals will talk to you about what the economics are. They'll talk to you about where we see the economy going. Remember, in the middle of this thing, we've got two responsibilities. Number one, we want to keep everybody safe. And we listen to the CDC. We listen to those professionals in healthcare about what they need, what type of PPEs are necessary, what types of protections, separations from each other. But then you also have the individuals who really want this economy to get back up and get started again, because you can't have a country survive very long if your economy is totally shut down. So in the middle of it, people are hearing from individuals that are saying, look, let's get the economy going right now. And then you have other individuals who are saying, we got to be very, very careful because lives are at stake. And the reality is both are correct. And the challenge for many of us in the middle that have leadership roles is to make the best of both, to be as careful as we possibly can, to promote good, safe ways of protecting ourselves and our loved ones, but also recognizing that we really do need to get back to work. And I think sometimes those two, sometimes what appears to be opposing concerns can make it difficult. And so what we try to share with people is the President of the United States clearly wants us to get back to work. And he's listening to what the doctors are saying, but he's also cheerleading. He's saying, we've got to get back to work. We can do this. We can win it. We can build this economy again. We can make it faster and bigger than it was before. And it's good to have that message out there. But then you've also got to be able to listen to those health professionals who say, but let's make sure that we do it as safely as possible. That can be confusing.
Well, Michael's question goes right along with that. Michael wants to know if you agree with the president's claim that the nation's testing capabilities are sufficient to allow reopening the economy in places like Sioux Falls. Let's start with Senator Thune.
Well, look, every part of the country is going to be different. And in South Dakota, we're going to be looking at a different set of data and analysis probably than a more populated, denser populated part of the country. And so keep in mind that it's not going to, it's not going to apply everywhere the same. And even though we listen to the CDC and National Institutes of Health and FDA and a lot of other of these agencies that have a lot of professionals that are providing advice and guidance, ultimately it's going to come down to each individual state coming to their own conclusions. And I think every state around the country is going to be different. And I hope that as we in South Dakota look at the information that we have in front of us, we can come to conclusions about how to do this in a safe way, how to do this in a reasonable way. And that's obviously, again, going to vary from state to state.
Now, Senator Johnson, talk about your thoughts on if we have enough testing to reopen.
Well, we've done a tremendous amount of testing. We've done more than 11.5 million tests in this country, and our capacity is getting better all the time. In fact, it's 28% better today than it was 7 days ago, but we don't have enough testing. We still need more. We want to continue to make progress. We're doing about 450,000 tests a day. That's a good number. We did about 450,000 tests yesterday. And the experts tell us that we need to get closer to that 500,000 or 600,000 a day to be able to really have the right kind of data we need to manage this. So we're getting really, really close. But listen, we don't want to give up until we are where we have all the data we need. Let's keep on it.
And Senator Rounds, we're speaking of reopening. Steve wants to know, what is your tipping point where viral spread and the public health outweighs a public's desire to open up the economy?
Yeah, that's exactly what's going on across the entire country right now. And so what we're trying to do is to be able to have enough good science available to make a good decision. And it does go back to testing. And, Don, here's my opinion on it right now. We have not had enough testing available. We've got testing and it's increasing, but our goal is between 40 and 50 million tests available by the end of September. And the reason why we need those tests is because that test is a snapshot in time only. And so if you want to open up the economy and you want to get going again, you take a test with somebody. Remember, about 3 days later, to be valid, you've really got to retest again. And so you've got to have multiple tests available, and they've got to be able to respond back very quickly in terms of a yes or a no, either I have it or I don't have it. So, the real issue, and his question is hitting right to the heart of it. At what point do you look at this thing and say, we're going to take the risk, we're going to put some people in peril, and do we have the ability right now with the PPEs to protect those first providers, people that are in the hospitals, and do we have the ability to be able to test and to monitor and provide therapeutics for individuals that are most at risk, people in nursing homes, people that are in hospital, people that have high blood pressure and that have underlying illnesses. If we have the ability to respond to those, then we need to begin opening up again. In South Dakota, we have not hit our maximum because people really did social distancing. They were careful. They took this seriously. And once we got a hot spot, we went right in. The Department of Health here did a good job of chasing them down, finding out where they were at, who they were working with and so forth, and beginning to separate them out. But there's a delay from the time that somebody is infected until the time that they actually are shown to be exposed and it's obvious. And so during that time period, they could infect other people. We have to have these tests available for us. And for those individuals that we miss that actually do get ill, we need the therapeutics. But nothing's going to be the same until we actually get vaccines in place. And that's what the real goal is here.
Well, our next question comes from Patty. She sent us a video. Here's her question.
I have a business in DeSmet, South Dakota, and I received help from the First Payment Protection Program that you offered. I don't know if we would have been able to stay open if I didn't have this money. I was wondering if there was going to be another stimulus package like this. My money runs out the first week in June.
Senator Rounds, other people may be facing that now. Will there be more help for small businesses here?
Right now, we're gathering the data to find out exactly what the need is. I personally believe the PPP, exactly the item that she is talking about, should continue on. Whether or not it continues on in exactly the same way or not, we don't know yet. We do know right now about 20% of the money that we allocated is still available and out there. But once you applied the first time around, you're probably not going to be able to apply a second time around once you've done about 8 weeks. Now, if she's done a full 8 weeks, that would be May and June. And so the first question I would say is have you followed and taken the maximum amount of the loan? We might be able to get you an amended loan provision. But there is a strong possibility that in any future plan, I think there shall be or there will be more PPP. Now, what came out of the House, and Dusty can maybe talk about this as well, they called it the HEROES Act. It did not have any PPP in it. And that was just a shocker to us, among other things that they tried to put into it. So it kind of set us back a little bit because not having anything in it at all as even a placeholder told us that we've got a long way to go to come to a consensus between the House and the Senate.
Well, speaking of that, here's another look at Patty's question. Representative Johnson, you voted against the HEROES Act last week. Anything that you're working on in the House to help small businesses keep going?
Yeah, absolutely. I think Mike said it right. I think you have a United States Congress, both the House and the Senate, that are willing to come together in a bipartisan way to refill the Paycheck Protection Program if it's needed. We are not going to abandon small businesses and even more importantly, their employees. That is the real beauty of the PPP. Yeah, those dollars need to, in large part, go towards salary. In 2008 and 2009, we let too many people get dumped onto social safety net programs. Don't get me wrong. I know we need them. They're valuable, but those can be very sticky programs. It can take years for people to work their way back into a job. We don't want them to lose the job in the first place. And so there are more than 30 million Americans who have their jobs today who might not if it weren't for the Paycheck Protection Program. Patty's a great example of somebody who's making it work because of that. So, Don, specific to your question, if Congress is going to be there, if we need to be, CARES Act passed 96-0 in the Senate. I would tell you anytime you can get Ted Cruz and Bernie Sanders on the same page, you can tell Congress is willing to come together and get done what they have to get done.
I want to get Senator Thune's thoughts on the PPP and how it's working, and do we need more?
Well, I think that's going to be a determination we'll make here soon enough, Don. I think it's about $160 billion left that hasn't been allocated in the PPP program to date. In South Dakota, we've seen, on the order of 11,000 to 12,000 small businesses who have gotten loans to the tune of about $1.5 billion. So it's been a lifeline for a lot of small businesses in South Dakota. If there is another round of funding, when this runs out and expires, my guess is we're probably going to have to be looking at whether or not there is a real need out there, and there would have to be some sort of a revenue test. There are some businesses who are going to continue to lose money if they're in certain industries, and there are some businesses who are doing okay. And so I think that this is going to be driven a lot by an assessment of where the needs are, how much do we need to add to that fund if it runs out, do we need to extend it? And my guess is there are going to be some more. This time was kind of just put as much money out there as possible. It was triage. It was like save this thing before the bottom falls out. I think the next round is probably going to be given a little bit more consideration about where the real needs are And I think for some businesses, that'll probably include some sort of an assessment of what their revenue losses are, some sort of revenue test.
Okay, well, our next question comes from Diane.
Now, she has a family-owned small business in Rapid City and says one major concern with the pandemic legislation is what safeguards will be included to protect businesses from frivolous lawsuits brought forth by employees and customers. Representative Johnson, your thoughts?
Well, we do want an economy that is comfortable opening back up when it's appropriate to do so. And so I'm really open to the idea that the legal framework we've got needs to be tweaked. I mean, clearly, if you've got a business out there that is being grossly negligent, if they are putting their customers and their employees wantonly at risk, we shouldn't be cutting anybody a blank check to be able to get away from that kind of liability. But DC does not always work like it should. But it is filled with a lot of smart people on both sides of the aisle. I'm confident that we're going to be able to come together to figure out what is the right legal framework to put into place to make sure we strike that balance.
Mr. Thune, I know you and I talked about this last week over the cell phones. What are the safeguards for small businesses?
Well, Don, I think that, as I mentioned last week, it's really important as we open up the economy. We're trying to recover from a pandemic, that we don't create an epidemic of lawsuits, which drive up the cost of doing business and really harm any kind of an economic recovery that we want to see happen out there. And I think some protections from liability that make sense. And as Dusty pointed out, that you can't have gross negligence or some sort of willful misconduct. But businesses, hospitals, schools are going to need some protection from frivolous lawsuits if we're going to get the economy back to normal. And that's something that Republicans in the Congress in the next CARES package are going to insist upon.
Senator Rounds, was there anything that you'd like to add?
Just that for anybody that doesn't think that's going on out there right now, frivolous lawsuits, there's been over 700 lawsuits filed, class action lawsuits that have been filed already. When you have that kind of activity out there, you've got to be able to address it. Can you imagine a teacher or a school being sued because they want to bring the kids back in and they become part of a class action lawsuit? This is not the way to do it. This is a pandemic. We've never had it. When we have an outbreak of influenza, we don't have this kind of stuff going on. And yet here we have a pandemic, and now we've got this huge rash of lawsuits already beginning. And we're going to have to address it one way or another, but we've got to be fair in how we do it.
Very good. Well, thank you all for those responses. We have a lot more to talk about, including unemployment and the rising cost of food. But it is time for a quick break.